Welcome to the Hair Loss Show. Dr. Russell Knudsen and Dr. Vikram Jayaprakash discuss issues relating to hair loss and the medical and surgical treatment of hair loss in both men and women.
Hi everyone, Dr. Jayaprakash here. Hope you're all keeping safe during this time and enjoying all the challenges of working from home or working remotely. For myself, from Dr. Russell Knudsen and myself, we're obviously stopped operating for the time being, and we're only limiting our practice to consultations, and we're trying to do as much of that remotely as possible. But it was interesting. I had a consult a few days ago that actually made me think a little bit, and it was just a 6-month follow-up, and the patient actually commented going, "Oh God, this is a great time. This must be the best time to have surgery. You must be really busy." And I was like, "No, we've actually stopped up." And he was like, "Oh, this would be the best time for surgery." And to be honest, I understood, because if you think about it, now is a great opportunity, a great chance to, if you're having a hair transplant surgery or any form of cosmetic surgery, now's a great time. If we're all in, wherever you are in the world, you're probably under some form of lockdown or social distance, some sort of restriction. If that's the case, it's a great time to recover, to have surgery and recover. And the comment that was being made was that, well, you know, if you're operating in a theatre setting or a theatre environment, obviously taking good precautions and sterile precautions, and so you're going to be safe from that perspective. You can recover at home, and once all these restrictions have been lifted, you're a lot more free and able to get back to work with as few people, knowing that you've had anything done as possible. And I get that, you know, and I understand. But the reality is that there are restrictions in place as to why any form of elective surgery is not being undertaken at present. And I understand that, and I get why that's happening. I think, and for good reason, we're trying to limit the spread of the COVID-19 virus, so social distancing is important. And if you think about, any elective surgery, specifically hair transplant, because that's our field of expertise, you can't get much closer to the patient than, just crowding around someone's head. But if I was told that, there are clinics around that are still operating, and I understand that. I get why they're doing it. I guess I understand from a perspective, or from a business perspective, that you've got to trying to keep the business running. You want to keep employees and keep salaries going, and so I get it from that side of things. I get it from a patient perspective as to why now is probably a good time to get a procedure done. But I really want to, and this video is not directed at people who are still having clinics that are open. I've got nothing to do with that. We've made the decision not to operate in our clinic, and I think we stand by that decision. I think that's the right decision. But one of the things, Dr. Knudsen and I, we talk regularly, especially during this period when we're not operating. We talk a lot about how we're going to restart things and what that will look like. And so I kind of want to paint a picture for everyone who's considering having surgery at some point. We have to think about what that will be like going forward, because the reality is COVID-19's here, and until and unless we have a vaccine and the entire community that we're in has been inoculated, we have to worry about the spread of that vaccine. We're going to flatten the curve, we're going to limit the spread. That's great, but we have to make sure that we don't continue to transmit the virus going forward. And if we look at hair transplant surgery, there are probably, obviously we've talked about this on different videos. There are two types. There's the strip form of surgery, and there's FUE surgery. And let's take strip, for example. Now, if you're really a real expert and you're really fast and you say, look, we can, we minimize contact with the patient. We'll take the strip out and sew that up really quickly and effectively, and that can be done in about 10-15 minutes flat. Okay, fine. But then you've got to make recipient sites, and recipient sites do take a while, especially that's where the artistry becomes involved. And it's not something I would say that can be done quickly, or you'd want to be done quickly. So it takes time, and that requires close proximity between the surgeon and the patient. But then, even if that's done rapidly, then it comes down to planting the grafts. And you can try and minimize the number of people. So even if you have only one person planting a graft, that means it takes longer, depending on the size of the case. It takes longer to plant those grafts. So there is going to be a close interaction between medical staff and patient during that time. And so you've got to be prepared to protect both the patient and the staff during this time. But the interesting thing that Dr. Knudsen, the point that Dr. Knudsen made, he was on a conference call with some other surgeons from around the world, and the feedback was, well, strip okay, one aspect, but what about FUE surgery? Now, FUE surgery there's a drill device, effectively, that drills around and cores around each individual graft. Now, that's fine, and generally there's not a lot of bleeding involved, but with any sort of drilling going on, there is sort of micro spurts of tissue fluid, and potentially blood as well, that is going into the atmosphere. So, and if you're doing that 1,000, 2,000 times, that's a lot into the general atmosphere that you're going to create. And so hopefully your theatre is designed in a way where there's good ventilation, but that has to, by the process of actually doing the harvesting, you have to be in close proximity with someone. So the concern, obviously, then, if you follow that through, is, well, if me as a surgeon is operating on a patient and that patient has COVID-19, doesn't know that they have COVID-19, because we would screen them prior to coming into theatre, etc. But let's say they don't, they have the virus, they don't show symptoms of that, and we operate on them, and that is then transmitted to myself or staff, etc. Now I've got the virus, and that's a problem. But not just in itself for me, but the problem is that potentially tomorrow when I'm operating, I'm now transmitting it to the next person, and the day after that, the next person, and to the staff, etc. And they're transmitting it to whoever they are in contact with at home. So as you can see, this balloons out with any sort of transmission. The numbers are no different than if you were just walking around the street or interacting in close proximity to other people. The difference here is the nature of the surgery that we're doing. It exposes patients, staff to tissue fluid that probably is not the case if you're just walking along the street. So this is the reality, and this is something that we are thinking about. We're currently putting into place, plans on how we're going to address this problem going forward. We don't have the answer yet, but we will do. We're pretty close to how we protect the patient, how we protect ourselves, because until we get the vaccine, which is probably a few months away, we have to have systems in place to protect the patient and protect the staff going forward. And with clinics that are currently operating, it's against, if I look at my medical indemnity insurance doesn't allow me to practice. It doesn't allow Dr. Knudsen to practice. So hence why, why we've stopped. And for good, like I said, for good reason. But there are clinics that are probably not as doctor-led. They're probably more led by technicians that are still operating. I think you should be careful if you're considering going down that road, because transmission is a potential risk. And so I think, we will get through this, but once we do, we will be putting into place protective elements that will hopefully be sufficient to stop any continued spread, specifically in hair restoration where we are exposed to micro molecules of tissue fluid in a theatre environment. So yeah, probably a little bit of a technical video, but I thought it was something that it was important to address, and hope you take it in that in that vein. Once again, hope you're all staying safe, be well, continue to practicing all those things, social distancing, keep your and good hygiene practice, and we'll see you again soon. Thanks very much. Bye-bye.